the psychology. Start over.
No, you're
Okay. Part of the psychology program with concentration and addiction. So I work in the undergrad program, but I also work in the MAC program, so the Master of Addiction Counseling program. And in my other life, I have a private practice outside of here too, so I get kind of the best of both worlds of being able to teach, but also be able to see clients on a regular basis too. So CSU, I'll kind of just do a short introduction and just answer whatever questions you all have. One of the benefits, I think, of attending the MAC program at CSU is you can be eligible for dual credentials when you're done. Anyone know what that means, dual credentials? So dual credentials mean that you can be able to apply for a licensed professional counselor, so LPC. So in our world, there are all different kinds of acronyms that go after our names for our credentials. LPC is one of them, probably one of the most popular ones. So licensed professional counselor. So in our program, you will be eligible for that if you take 4 additional courses than what we offer. If you just take the courses that we offer, you're eligible for an LAC, so a licensed addiction counselor. You'll have all of the classes that are needed for that. And then your internship gets you about halfway there because you also have to have a number of clinical hours working towards that licensure as well. So you get your LAC, you take 4 additional classes that we offer, and you are set up to have a dual credential, which is highly marketable in our profession, because as many of you probably know, that when you're working with people, substance use is often part of the component that we're working with. So not only just mental health, but also the substance. So huge to be able to say, hey, look, I have both credentials, so I can pretty much do about anything. Our program is kind of unique too. The first year is just all coursework. So you have, each semester you'll have 4 classes. We run on Tuesdays and Wednesdays. So first 9 to 11:40, you get a little break. You come back 1 to 3:40, I believe it is. Then on Wednesday, same thing. We just switch the curriculum around. You have a pretty small cohort. I think this is the biggest cohort we have this year, and it's 18. But every year, we're fairly new. This is just our 3rd year. And we're going into our 4th year, so we're pretty new at doing this. But each year it's getting larger. So, but I think the largest class I have right now is 10. So we do try to keep them small. Were any of you in the presentation right before me with Mary McMahon from OBA or BAJ now? Okay. So the state guides most of, actually it's all of our curriculum that we teach, except for the LPC courses. And so they also mandate how many clients or how many students that we can have in a course. So they will always stay small. I think 21 is probably about the maximum that we would ever have. So you get to know your cohort really well. You get a lot of friendships to get built because you're with the same people all the time. So first semester, that's the curriculum. Second semester, we build on that. We have a lot of prerequisites that we have to get out of the way that first semester, and then the second semester are just all the sometimes higher advanced classes. Then you start an internship. And then your whole second year, no coursework, all internship. So depending on if you're going to do the LAC track, so just do the MACP program, you don't really need to remember this, but it's 840 hours that you have to get for an internship. If you're going to be dually credentials, you just have to add on some, and it's 960 hours for that dual credential. And then once you leave, you are pretty much set. You have to get probably about another 1,000 hours of work to be able to apply for those. But you're really, really set to be able to work in the mental health profession and the substance profession. But I just like it too of lots of coursework, but then we're going to give you all that other time just to be able to complete your internship. We have, I don't even know how many, but we have numerous internship sites contracts set up here in Larimer County, Weld County, and also in the Denver area. But then it's really easy. If you have a specialty that you like, oh, I want to go to this site, it's really simple to be able to set up a contract. And then we add more sites every year, it seems like, just based on our student need and what they're interested in. I think we have a rolling enrollment. There was a little mix up that might benefit anyone who's really ready to start school right now. It says March 1st is what we changed it to, but on the website it still says April 1st. So if you are really interested, you could still get in for the fall. But we also have a rolling. So if you decided, in a few weeks that you're interested, you could apply and possibly be ready to go for the fall. So let me see what other things. The coursework is I mean, it's substance use, so heavily focused on that, but then you're gonna get all kinds of other mental health components to it too. So how to work with the DSM. How many of you work in the field? Anyone? Okay, so if I'm talking like foreign language, just tell me. The DSM is that big manual that we use for all the diagnostic criteria, for the hundreds and hundreds that we have now. But you'll get that, you get motivational interviewing, you learn how to do groups, you learn how to be a supervisor, just something they don't usually get. It's just you've been at the agency long enough and now you get promoted to being a supervisor, but we'll teach you how to be a supervisor. Pharmacology, lots of video recordings that might scare some of you. One of the best ways to learn when you're doing counseling is to be able to video record it. And so you get quite a few opportunities to do that. And then we can critique them and you get to see yourself on camera of what it's like to interact. Because oftentimes out in the real world, clients aren't going to give us feedback, just may not have a client come back. And so the beauty of what we can do is like, oh, those are some things that I didn't even recognize that I was doing, or, oh, here's another area. In our jobs, we don't get a lot of direct observation for therapy. It's more of, here's what I think happened in the session and me reporting back. But with the direct observation, then I have someone else that's going to be able to help and guide me and support me in that. So we do quite a bit of videotaping. Let's see what other classes am I missing. I think that's probably about the biggest component to it. I'm sure I missed something, but what questions do you have? Come on, we have a good 20 minutes at least probably here.
You said
Yes.
pharmacology.
Yes,
What does that like look like as the class?
it's a very good question. So really, we're gonna break down different substances and we do a lot of neuropsych about like how they react in the brain, what's the impact it has on the brain, but then also becoming very familiar with what those substances are. Because in our field it's ever changing. You know, week from week, people are creating all new ways to get high. And so it keeps us up to date on those, but we're also going to be able to identify what does withdrawal look like? What does someone who's maybe sitting in front of me intoxicated look like? So a lot of times people think that pharmacology is going to go over psych meds. We don't do that. We'll talk about them on some level, but we're not going to do a deep dive into psych meds, but more just into substances and the neurobiology of how they work. That's a really good question. We do, though, there is a component we do talk about psych meds because as a clinician, we need to know what our clients are on. We need to know what some of those impacts and some of the side effects that, hey, that might be your med and why you're feeling like that versus your depression is increasing or something like that. So it's always good to know. Yes, please keep going.
Okay. So for the LAC,
Yes.
so I'm like familiar with like the LPC credentials and everything, and
Yes.
like what like the tests and like the hours and everything.
Uh-huh.
What does that look for the LAC then?
It's a great question. So another beautiful thing about the addiction side of it. So with an LPC or most of our mental health licensure, you can't start earning any of the hours and accruing those hours until you graduated. So that day you graduate, typically then you can start accruing those hours. With the substance world, we can start accruing those hours prior to graduation. So some of our students actually have all of their hours. So for an LAC, if you're in a clinical master's program, 2,000 working hours. And those hours need to be directly working with clients. And then you have to be getting supervision at the same time. It gets a little complicated, but you have to get supervision in the same month that you work with clients. Otherwise, those hours do not count. So in the mental health field, they like to have them spread out over the 2 years that I'm working, but they don't designate how many a month. And in the CAC world, we do. So you need 2 hours of supervision every month if you're working full time, and then 2,000 working hours. You have to take and pass the MAC exam, Master's Addiction Professional, I think it is. Again, we like to confuse things in the CAC world. It's not for the MAC credential because there is a MAC credential, but you need to pass the test to be able to get the LAC credential to get the licensed addiction counselor in Colorado. So all your coursework, take the exam, you have to take the jurisprudence. Anyone heard the jurisprudence in Colorado? Anyone have the joy of taking it? What, did you guys like it?
I like it.
Yeah, it's ridiculous. Someone from the state just here, I should say too loud. They would probably even agree with me. It's ridiculous, hard test. It's open up. You have 60 days to take it. They just really test you in every way you've ever seen. the hard piece is like, oh, A looks like the answer, but then the next one will be like, is it A and B, or is it B and C, or is it A, B, C, D? They don't make it easy. So you have to pass the jurisprudence, and then apply. And then you won't have you have to have a board verification form signed off, showing you've completed all those working hours and that you've been getting supervision as well. So for most of our students, it's about another 6 months if they're going to be working full time. You can get 2,000 hours in a year for your LAC or for any of the CAP credentials. That's all that they'll count is 2,000 per year. So really, with your internship, if you do the 960, you're almost halfway there. Many of our students, though, have more hours than that. We're also bringing on quite a few agencies, and just with the kind of state of where we're at, we need a lot of mental health and substance use professionals. So now we're seeing more paid internships. I didn't even know that was a thing when I went to school. We did not do paid internships in the human service field, but now it's actually quite common. And a lot of our agencies will hire you. We have one that does an interesting one. They do your internship hours don't count, but they're gonna hire you full time, but they're gonna pay your other 20. And I think they're making about 22 an hour. So not too bad. But quite a few now can get paid internships as well.
I was wondering, do you have to get the CAT and the CAS before getting the LAC, or can you just go straight to the
We can
LAC?
go straight for it. It's interesting, this year we have 2 students who already have the CAS. So they've actually already had all the coursework we're teaching, but they don't have the masters, so they can't get the LAC. So they're back just to be able to, I mean, they haven't taken some of the courses. And because we teach it in a university setting, we don't just go off the OVH or VHA curriculum, we add to it because it's university. So they've been able to get a lot more from just the 2 or 3 day class that you can get in the community. But now you can just come straight in and we're gonna give you all of those classes. I'll confuse you, but I'm gonna say one thing. So if you have a master's, you only need about 7 classes to get your LAC. Because we're gonna give you credit for all the coursework that we think that you've done in your master's and your undergrad. But because we know many of our students don't have any experience, we're gonna give you all of them. So you're gonna get all of the classes for a CAT, which is a certified addiction tech, all the classes for a CAS, certified addiction specialist, and then the LAC. You get them all. So people don't have to worry if they don't have any experience, we're ready for that. And even people who have experience, it's still really good to go through those courses. When I do videotaping, some of the people that struggle the most are some of my students who have been working in the field for 10, 15 years. They do not know how to ask an open question. Because they've got so used to just closed questions and how we did it. So it's still a good learning experience.
What do you look for in applicants?
It's a really good question. I just learned some of this too, because the director is Dr. Connor in our program. I don't do any of the admissions side of it. But for those of you here, give us a little tidbit. He said what they really look for is in your personal statement of, do you want to work in addiction? Because people are finding out about our program and they really just want to do counseling, mental health counseling. And so they know that, oh, I can just go there and get 4 classes and also be able to get my LPC. So we want people who want to work in the substance use field. So in your personal statement, it looks really good and it helps you if you talk about wanting to work in the substance use field. So we're going to look for that. We look for experience. If you've come from CSU and you've been part of our undergrad program, we look for that. And then grades are the last that we look at. So I think it is that we look for a 3.0. But he did say, he did not name the person, that I'm working with someone who had a 1.7. So that is not going to be someone that we don't work with. If you have a desire, you've been working and you have a real strong personal statement, then it might be a good applicant. And not everyone gets admitted. I think last year we had 60 applicants and they accepted 18. But I think people who are very interested know how to apply probably. Good question. Who else? Yes, please.
So then for the LPC, so there's 4 additional classes.
Yes.
Where do those classes come from and where do you get those?
We have a new program just starting this summer. We had to pull those classes from the education department and the human development department. Well, their students had priority, so our students were typically having to go an extra semester into the summer to be able to get those classes. But we listened to the feedback of our students not being able to get in, and so we've created our own coursework. So this will be our first summer where we're gonna offer those ourselves. It'll be asynchronous, it's all online. One class is an HD, human development class that we can't offer yet. So that one is going to be part of, that you still have to take it through the university on their side, but the other courses we'll be offering this summer. There's 3 that we're gonna offer, you can take those on this summer. And it'll be taught by someone in our program, because some of the complaints we got before were, it's like, it's just those things that we have to do, some of the research or assessments, but the assessments are based on the education model, have nothing to do with our model. So now we'll be able to get assessments that are specific to addiction, which would be super helpful versus learning how to do career counseling. We do that in some of our work, but not as helpful as learning how to do some of the ASI or SBIRT and those things. Yes.
If someone's considering like an MSW versus a MAG, what kind of things would you say to consider?
It is up and coming, but I've been hearing, I'll be honest, for a little while, there will be a track for you to be do MSW and an LAC. I keep hearing it's going to happen, but it hasn't yet. It'll be a 3-year program versus ours is a 2-year program, but you'll be duly credentialed in that. I have an LCSW, so, and I did my work here. If I only had to go to school for 2 years and get 2 credentials, I would do that. And I think now LCSW, we used to be able to do more, but really that world is changing. LPCs or an LMFT can't bill for Medicare, but I think that's changing in 2024. So really, I still see some schools, you'll need an LCSW, some medical social work, but really it's so much broader now that an LPC, that would be fine. And I love the NSW program here, but I didn't have 2 credentials when I came out. I had to get my LAC in a different way. So that would be fine. But someday they're gonna have 2 tracks and you can do both.
Since we're plugging, sorry.
Yes.
I'm from the University of Northern Colorado, so, we have the LPC program and it automatically has the LPC built in, so we have both of them, but we're not emphasizing on the substance abuse, we're emphasizing the mental health and then the substance abuse on the side. It's
Okay.
almost like a different marketing almost.
Yes.
In there, but we do have the LPC
Okay.
also.
Do you have an MOU with VHA?
I believe they have, and we're building right now an undergraduate program that'll get you the CAC and the CAS along
Okay.
the way.
Okay.
So that actually brings me to a question that I had, and maybe both of you can answer this, because like I went to UNC and did my master's there in clinical counseling, and your dual program is phenomenal. However, like they're not going to be the best fit for everybody.
No.
How would you encourage students to find what considerations do you think students should be thinking about to find a graduate program that's a good fit for them?
That's a great question. Yeah, because it isn't. I mean, they're both great programs. They both provide you a lot. You're going to be in the field. You're going to be doing the thing. I don't know. I think that when you go and you talk to people, you know where your fit is. You kind of just feel it. And I think applying to both, I would tell students to apply to everything. They'll know my students are in here going, yep, she says apply to everything. And and see what sticks and go on the interview to see, because a lot of times on the interview, I think you can work in the field the way you want to with both ways, I mean, you could do, and once you get to the master's level in any of these programs, you're kind of making your own way, right? I mean, you were able to kind of design your career and get experience and, kind of do all that. I think you can with both of those. So I think it's more of a fit for you and how you feel, and it's a very qualitative, subjective kind of thing. I don't think, I always tell my students though, that if they're really heavy right now, like because CSU is much more developed as a substance abuse training, I tend to say, if that's what you really want to do, if you're in it for that, then go for the dual program here, because we're still kind of working on that from the undergraduate and to build up those models. But, you do whatever you want at both of them. We need so many people in this field, it doesn't matter.
Yeah.
We need more slots at the graduate schools.
Yeah.
Would be the best.
Yeah.
What was your answer? I'm curious to know what your answer.
Well, this is how I decided. Who doesn't make me take the GRE? I'm not taking the GRE.
And
Cost
yeah.
was another one, because I really looked at DU. They have a really good clinical program. But it was like 3 times the amount that I would have paid at CSU. And then for me, I was still working full time. So I needed a program that was also going to allow me, because I had a family. I chose to wait till I had 3 children to go back to get my master's. So I still needed to be able to work. So I needed one that was going to work. So I didn't have to go to school 5 days a week. It was really condensed. But then what I didn't know either, and I think that's where you can do your research. I didn't realize that the MSW program is heavily here at CSU in research. So I learned a lot about research, which I hate. I do not want to ever do research. I read the summary when I have to do research, and that's how I do it. It wasn't very clinical. And so knowing really what your program is going to specialize in and looking into that more, because I got very little clinical work until you do your internship. And I tell everyone that as soon as you do your internship, that's really where you're going to get the work. Because we do know that not everything that we teach is going to be applicable to the real world. But when you do that internship, then you're gonna, boots on the ground, and you're gonna get the experience too that you're looking for as well. But I didn't even know that you guys were doing the addiction side of that too. So that's
LCSW's been
awesome.
around for a while, but it's just not, that's not their marketing tool. It's
Right.
the LPC and the clinical.
Yeah.
I mean, the MFG has been there, or
Yes.
the PhD programs have been there.
For a while, yeah. Right, and I didn't realize that there's not many programs that you can get a master's of addiction counseling. Some of the students have done more research than I have. I think there's like 7.
Yeah, and it's kind of a new thing.
Yeah.
too.
It'll be there, it'll be coming, but if there's not very many, if that's something that you're really interested in, then you're marketable in that way too, because I think it's 1 of 7 in the country. It won't stay that way though. Yes.
For your students, do a lot of them have full-time jobs as well? How do they balance the internship, the schoolwork, the full-time job and all that kind of thing? Is that something I've been considering? And maybe even doing school like part-time so I can maintain my full-time job?
What I see happening most is their jobs are their internship. And so there used to be more of a philosophy where we didn't allow that years ago. I've seen that change now. At the university level, where it's now like, no, you can get paid for your internship. But I was also just told recently that there is a bill in legislation saying that you no longer can have unpaid employees like that. That you either have to give them school credit, which I'm sure some will, or you have to pay them because they're going to be providing a service to your agency or your business. I was talking to some other professionals in like engineering and business. The human service field is one of the last few that don't pay for interns. If you go into architect or engineering, they make so much accounting. I can't believe what they can make as an intern. We didn't get paid. But I'd say probably well over half of our 2nd year cohort right now who are doing their internship are all getting paid almost. So if you can find those places, and if you guys are local, Summit Stone,
I used to be at Summit Stone, and yes, they are paying interns.
and they
Yeah.
just hired, I have 10 in my one class and they hired 3 in 1 week. So we have Longview that's about to open at the end of the year, and they have to hire over 100 staff, not all clinicians. But you can get a job in the field, even though if you don't have a ton of experience, and get a paid internship and still be able to balance home life and work life. And I wouldn't say that, we're not super heavy at CSU in our department on homework. In my philosophy, is like, I want something that's gonna be applicable to you. I hated those, I still remember the one paper, 20 pages on what I thought success was. That's never helped me. I've never used any of that. So like, my students right now are doing a supervision contract, so that when they start to supervise, they have something that they can pull out and that they can use. So we really try to make it applicable to what you're going to be doing in the field versus that busy work. And I have heard students be like, shouldn't we be getting more homework? Like, if you want to, we can, but some of that's just busy work that we give. And so we really try not to do that. So most of our students now work full time. I do have a few that don't, but I'd say most of them do, and that they can balance it out. And, I'm not one for not ever having a day off, because if we were in class 2 days a week, then we need to work.
Wendy, can I ask something?
Sure, please do.
You'll make it work, like it just works out. Like I worked full time in grad school and did my internship and other stuff. What I want you all to hear is that you all, as students going into behavioral health, are in a position of power that has never existed before, or at least that I've never seen before. and that employers are scrambling and fighting over you all. And so you're in a position where you can choose where you go to graduate school. You're in a position where you can demand a paid internship. You're in a position where you can get a good salary, like coming out of school. Like, I just really want you all to hear that, like, you have choices and you don't have to settle for anything that isn't a good fit for you, because there's gonna be a ton of opportunity. Every single agency I work with is understaffed right now and just really, really needs people. And we keep talking about Longview opening, like it's supposed to open later this year, and they need, I mean, dozens and dozens and like, I think truly over 100 people for that facility. So that's my soapbox. So
We have people, agencies asking to come and speak to our students. So I think I've had 3 agencies that I've been able to build some time into the class because they're recruiting. So we did not have that when I was in grad school. The other piece that has changed since, back in the day, but you couldn't just go and start doing private practice after school. You had to work in an agency to get your hours, and you could not bill insurance with an LPCC or the other candidates. You can now. So as long as you're under a licensed person. So I see so many people going directly into private practice now, or in private practice settings, where it was not a thing back, 10, 15 years ago. That was not something that you could do, and now you really can. I'm a big push for agency work, because I think you learn so much working in an agency as a team, but also just the clients that you get to work with too before you just start. But I see a lot of people go straight into the private practice setting as well. Do you want to add to that?
No, I'm finding that interesting that they're, because it always was, you're not gonna be in private practice
No,
for years and
never.
years and years and
No.
years, you're gonna have to pay all these prices to get that experience. I still see the value.
I do too, yeah. Well, the other, to speak to that, I did, because I was working full time and I had to go to class. And so my internship was all in one day. I would not advise that, but I did 15 hours. I was at Mountain Crest from 7 in the morning until the last person left for intended outpatient in the evening. It's just how it had to work, because I still needed to maintain my employment. So
You allow part-time?
we do not.
Okay, yeah, UNC does have, for our LPC
Yeah.
program, has part-time too, so if you get accepted, you can do part-time. Sometimes that works out, but I think that everybody's so friendly about their class schedule. I don't think it's friendly, it's not LCSW here, but make it work.
Yeah, the MSW program here is I did mine part-time. It just took me 3 years to do it versus 2.
And then can I ask you, then the LCSW question is,
Yeah.
did you write your LCSW after that, or did you have to do additional work to get the LC part of your?
The LAC?
No, for the LCSW.
Oh, no, I didn't have to do additional.
Okay.
That's just my
Just
licensure.
your license that you wrote for that, okay.
Yeah, so 2 years after the MSW, all my hours, and then,
That was just a side note, I always forget how you get the license for that.
I know, there's so many different ways. Private club credentials. Other questions? Yes.
So in debating between whether or not to get like a master's versus like a PhD.
Yes.
Like, do you have any like advice or, I don't know, like,
Yes.
yeah.
I'm one of the few that get to teach here, and I don't have a PhD. It is doable. You can do it. I don't see a lot of people that, when I get scared sometimes when I have to go to a meeting and they all have a PhD, but some of them haven't worked in the field forever, and they only have the academic experience. So if you want to do a PhD, if you want to do testing and research, I would strongly think you need to get a PhD. And there's probably some other you guys could add to that. If you want to work with people, you don't need a PhD. So there's no reason to keep going on, but people push that a lot. And I think it's because you're around people that all have PhDs. We have a PhD in our program that pushes, you don't need to do this. I wanted to teach and I wanted to do research. That's why I went and got my PhD. If you want to work with people, you don't necessarily. But if you're really into, if you want to do cognitive testing, neuropsych testing, and you love writing reports and doing assessments, then you need your PhD. But we get to do what we do, I don't know if you guys have that.
Yeah, if I can add to that. Wendy is absolutely right, like there are very specific things where you need a PhD. However, the PhDs, who I know in my world who see clients get very frustrated because they're not paid more than somebody with a master's degree, so. And you can change your mind, like you can go into your master's program and you're gonna get a PhD. You can change your mind anytime, like you don't have to know right this second. I would actually encourage you not to know right this second and just keep yourself open to. Yeah, exactly.
Well, it is amazing what people are charging now too. I just saw someone just got out of school in December and is charging 150 an hour. I do not charge that, but I've been doing this 30 years. But I mean, that's what I used to think that PhDs would charge, but people are you can make a living in mental health and substance use now. When I first started, I had 3 jobs because I couldn't, you didn't pay, but now, it took me almost 20 years to make 60,000, and starting right now is usually around 50 to 60,000, even higher. There's an agency in town that has someone, I think at 98 for a clinician, and they want to be, that's where they want people to be the benchmark, is that we need to start paying clinicians more. So you're coming in at a great time. And then if you're interested in the psychedelic work, you're coming in at another great time, because that will really probably be what we're going to be seeing. Mainly people working with ketamine, psilocybin, MDMA, all of those will be probably for you guys what you're going to be doing on a daily basis sometimes. What else? Any questions? You can ask Stephen if we've already looked at it.
I was like, I probably missed the good time for it.
I would say, just keep listening
Okay.
and then do something.
Great. Anything that you guys? What else? You have more?
Could I ask one more? What do you see your students doing when they come out, like from your environment?
I still see quite a few doing agency work. I'm trying to think. Some are like in corrections. They work like at community corrections in the short term or longer term, drug and alcohol. See, I have some who are working at North Point, in residential treatments, and then some that have gone into a private practice setting and are working under a clinician, but it looks, I mean, they see clients all day long. I'm trying to think where else. Neurofeedback, we have several working at the neurofeedback center here. So they've been able to get that certification. And it works nice with an addiction component as well. We do have several that are doing ketamine assisted treatment. We have one student, he's actually our second year. He's doing all kinds of cool stuff. He works at the Wholeness Clinic and he's doing the MDMA study. He was part of that. And now they're doing LSD. And so they're having some research on participants in a group with LSD. So quite a few students are more moving, I think, in that direction. It's just super expensive right now to get trained in that. Last I looked, it was about 5,000. So he told me, I feel like he has the inside scoop, it will be coming down. I was like, 5,000. That's a really expensive training.
I do want to go the research route,
Yes.
PhD, and I was wondering if there's companies around here that do research, or if it's just mostly academic, where you get like.
You know, we're so fortunate, the Wholeness Clinic, I always call it clinic, it could be the Wholeness Center. Dr. Shannon, he has, I think there were only 7 when it first started MDMA FDA clinical trials, and we have one here in our community. So that was all over the world. So they're doing a ton. Boulder is doing a lot of research as well. But in our department, there's a lot of cannabis and alcohol research happening. So no, I don't know about agencies outside of universities. I'm familiar with the Wholeness Center. I don't know if you guys know of others who are doing it.
I don't know of anything else locally. I mean, so much of the research that happens is academic, and then also, there's going to be some federally funded research as well that you could look into, but or even like public health research. So something interesting to look up.
Yeah, I can connect you with a student who's doing that. I don't know how he did that, but he got in and he's all these cool things of being able to sit in and, you know, watch people do their MDMA treatment. Which, you know, there are very few people being able to do that. So he had someone inside that he just wiggled his way right in there. But Boulder has an agency doing it as well.
When you say the homeless center, what are you talking?
It's the wholeness,
Wholeness, like whole.
whole, yeah, WHOLENESS.
Okay.
Yes, yes, out on Prospect. But yeah, Dr. Shannon is pretty innovative with what he's doing, over there. But yeah, they had one of the trials for MDMA, so it's been pretty interesting seeing the research come out of that and what so much better than some of our psych meds with what they're seeing with the results of that. And ketamine assisted therapy as well.
Oh, you probably answered this at some point, but what are jobs that like, what if, so after bachelor's?
Yes.
What are jobs that you can get into full-time, like while you're applying for master's, or like if you're taking a gap year, like something like that?
Huh? So there's different agencies that still will be able to hire some at Stone. Larimer County Community Corrections is another one. Turning Point, I know, they hire bachelor's level. We have they do like behavior coaching. You can still work with individuals. You can start working towards some of your CAC hours even. Where else do you guys?
North Range.
Oh, yeah.
Yeah, if we walk around in that big room, all those tables that are in the big room, that's probably all those people.
A job within the.
Yeah.
So, yeah. No, and honestly, I make the flippant about that, but truly like the bachelor's level positions are really the ones that agencies are having the hardest time hiring for right now. And I think a lot of people, and that's one of the reasons why we do this event is so many people don't realize that you don't have to have like a master's or a doctorate or an MD to be in behavioral health. You can come in with a high school diploma or a bachelor's degree. So yeah, all of those agencies represented out there, really, they're looking for you.
Add a little bit to my clients at North Range. They are now hiring bachelor level mental health. I don't think that. But they work as like a counselor with supervision, so they can do all of the work with the client and then a licensed person do all the diagnoses and things like that. So you can be doing all of those things at a base level.
That's what I did at North Range.
Okay, yeah. So
Which program do you work in?
Access team,
Okay.
yeah, so, I've only been there for about 8 months, so, I really like it. Prior to that, I worked with, individuals with intellectual and developmental disabilities, so, I was gonna ask, like, so a long time ago, like, we're talking catalog year 2006.
Sure.
I almost had a dual master's in industrial organizational psych and
Okay.
developmental psych. And life happened, and unfortunately, I never finished my thesis. Is there someone that you would recommend me talking to see like
Can those count or what can I do?
what's that?
Like, do those count? What can I
Well,
do?
I don't know that they would necessarily count.
Okay.
But just, I don't know if there's programs out there that do take that kind of thing into consideration. I am, I was doing a very scientific route and now I'm more like interested in the clinical route. So,
Yeah.
So I don't know if those classes would even be applicable.
Okay. We have organizational psych in our department. I can connect you with someone. I'm not familiar with that one as well, but I can definitely connect you with someone. You can meet with an advisor and they really will tell you if this will count. I know in our program, it's hard because the state mandates our curriculum.
Mhm.
And so it's harder to get classes that can count. They can at times.
Yeah.
They're pretty strict about what it has to look like and your syllabus had to have these
Sure.
things in it. But I have in my private practice, someone who went back to nursing and they're taking classes that she's had for many, many years ago. So
Okay.
it's doable.
Okay, yeah, I guess I just need someone to kind of like go over everything that I've done and see where I'm at and like, help me make the right choice in terms of, do I want to go?
Yeah, there's advisors probably at UNC or at CSU that would definitely sit down with you and help you figure that out.
Okay. And I'd reach out to both and kind of see what your options are, see if
Yeah.
they're gonna give you the better route, because they will work with you a lot.
Okay.
And they'll do the best they can. I mean, I'm an advisor, and so our whole job is, how do you find the loopholes, right? How do we- So that it can work. That's my entire job, so.
Okay, and you're at UNC?
Yeah, I'm an undergraduate advisor though, but I'll get you your number for your graduate person.
That'd be great.
And, yeah, see what's out there. Yeah, right now, they're really willing to work with a lot of people too, because low enrollment, we need people in the field. They're willing to do things. We got state licensure issues that may run into it, but other than that, schools are working with a lot of students now.
Yeah.
Much more than they were 5 years ago.
Really? Yeah. Good to know.
So we'll go in.
Yes.
For your program, what would your like thesis or capstone project look like? Is there one
Nope.
or?
We'll do a thesis. Your internship.
Okay.
That's really your capstone. So that's the other thing I looked at when I was in school. Like, do I have to write a thesis? Or- Yeah, I did. I hated it, but it was in a group, so it was a little bit better. But again, I don't use that. I've never used SPSS or whatever that system is that you have to do for all that. You did that. But people love that, so no, we don't have. And I'll tell you, we don't, and that, I don't think this is a bad thing, but we don't have people writing 15, 20-page papers. APA style, all of that. I've never used that.
No.
I've never used any of
Well,
that.
I do. I'm an experimental psychologist, so.
You do it.
I do, but not within the program. It's just not. It's necessary for me as an experimentalist, but that's it.
Right. It's good for me at CSU and for, academic, but I've never had anyone look at my court report and be like, hey, it's not APA style or whatever that stuff is. You need to know how to write, but you don't need to know how to do a research. Unless that's where you want to go, you do. But we would not be the program for that. Yeah.
Is your program a part of the behavioral health incentive program? Like what kind of scholarships and things are available for specific programs?
I'm not very good at that one, so I could connect you to Dr. Connor. We've had 2 students be able to get their whole tuition paid for through NADAC. They have a fellowship program. But other than that, I know AmeriCorps does some too, but there's not a lot of other ones that I'm aware of for our program. But I can ask that question and get back to you. I know, and I don't even know why we paid their fees. I don't know why, but I guess we had extra money for the past 2 years. We paid the students' university fees, not tuition. Students got really excited. They were paying their tuition. Not paying their tuition. We paid their fees, but that was like $600. They tried to give back that way. The one thing that you can do is work for an agency. There's a state and the federal loan repayment programs. My colleague that I work with had 90,000 paid. He worked at Saloon, so he had to work with an underserved population, and he had all of his paid for. And there's agencies that are doing that now. His wife did the same as the federal, and I think she's a doctor. She had 190 paid for. So you can, if you're gonna work, and most of us are all working with underserved population, that you can, there's loan repayment programs that are really, really good. I think for the one in Colorado, I think you have to work there 3 years or 5 years, I can't remember. And then we pay up to 90,000.
I think I was looking at the federal one and I think it was 3 and
3 years.
a certain.
Yeah.
I also know that North Range has their own program, that you work for them for 3 years. You basically sign a contract and they cover, I think that's 24,000.
And I'm really glad costs came up, like before you take on any student loan, that I'll be looking at those repayment programs and what's available, because again, like you were in a position with a lot of choices right now, and I would strongly encourage you to take advantage of whatever, all of the programs that are available rather than taking on any debt.
Do you guys have, okay, sorry, like switching gears a little, do you guys have any advice for writing like personal statements?
Just be yourself. Like, remember in my practicum at UNC, like what Wendy was talking about, like when they're taping your sessions, I would talk with a whole like different voice. It actually, like I have a cold right now, so it probably sounds like this one. I like, they're like, Carly, what are you doing? Like, why, like, they're like, you are funny and like outgoing and like silly, and in there, like, who is that? I'm like,
Yeah.
so really, like, just be yourself, like, and really, if they like don't want you as who you are, then like, fine, like the next university will, and it's gonna be a better fit for you. So just, I would just say, show up authentically and just find that best fit.
I think the other piece too for us, a lot of times people think in the addiction field that you have to be in recovery. You do not. And I think it is the only field where people will question, have you had this happen to you? Because I always give the example, I don't, the oncologist, I don't ask if they've had cancer. That's not something, but we see that quite often in addiction. It's like, have you ever struggled with substance use? Have you ever used? It's like, whether you have or not, I can still be effective and I can still help you. So just remember that too, that you don't have to, if you are in recovery, great. You have experience. Sometimes I even think that makes it harder to not identify and be like, well, you need to do what I did because this worked for me, because we all have a tendency to do that, whatever that is. But that's not a prerequisite. So why are you interested? Just give them like, really, why do you want to do this work and what is that about for you? And I think that's all that you can do for your personal statement. But I love that you say that. That it is so true when people, when they get in a video, I'm like, what are you doing? Like, it's like, hello, how are you? I'm like, you don't talk like that in the classroom. Why are you doing that? But I have had people too, it's like, well, that's how my therapist talk. I'm like, no, that's not your style.
Yeah.
Yeah, be you. I want to hear you, because that's what's gonna make people want to come back. You can be funny, you can be sarcastic. Sometimes I'm funny, my clients don't think I'm funny, and I have to prepare, but you can do those things. We want to see who you are. And I would say in the math program, we have just a varying, we need more males. I don't know where all the males are. We have no males this semester, this cohort. And last one we had, I think, 5, but it's a wide eclectic group. Some people have had a lot of experience and some people have no idea and have never worked in the field, and they've been like literally an accountant and then they come over. So you don't even have to have prior experience either. Yes. Come on, you probably want the TRE. Oh, yeah, 11:15, 11:18. I have some pamphlets if anyone would like one.